My name is Lesley. I'm a registered nurse and a family nurse practitioner student. Today I'll be performing a complete head-to-toe physical examination on a healthy 31-year-old male. Before entering the exam room, we obtained the patient's vital signs, which were within normal limits for the patient's age. We obtained the patient's height and weight and calculated BMI, which was normal. And we checked the patient's cranial nerve 2, which is the optic nerve, and tested visual acuity by the Snellen eye chart. The patient has 20/20 vision in both eyes, not corrected with contact lenses or glasses. Can you please tell me your name?
Zach.
And your date of birth?
9/4/87.
And what city are we in?
Walker.
And what day of the week is it?
Tuesday.
Great. So the patient is awake, alert, and oriented. His speech is clear and coherent. I'll next assess the patient's head and neck. I'll start by assessing the patient's skull for symmetry, nodules, tenderness. I'm going to assess the distribution of the hair, check for any flaking or lesions of the scalp. I'll next assess the patient's face. Eyes and ears are symmetric, nose is midline, lips are pink and moist, sclera is white, conjunctiva is pink and moist. I'll next assess the patient's fifth cranial nerve. I'm going to assess the temporal and masseter muscle. I'll have you clench the jaw and open your mouth and move your jaw from side to side. Great. I'll further assess the patient's fifth cranial nerve. I'll have you close your eyes and let me know if you feel something soft, dull, or sharp.
Soft. Soft. Soft.
Great. So cranial nerve 5 is intact. I'll move on to cranial nerve 7, which is the facial nerve. I'll have you raise your eyebrows, smile, frown, and puff out your cheeks. Great. So cranial nerve 7 is intact. I will now continue to assess cranial nerve 2, which is the optic nerve, by testing the patient's peripheral vision. I'll have you tell me when you can see my hands.
Yeah.
So the patient's peripheral vision is intact. I'll continue to assess cranial nerve 2, 3, 4, and 6 by assessing the patient's pupils. They are round and symmetric. They constrict with light directly and consensually. I'll now check for accommodation of the pupils and convergence of the eyes. Now I'm going to test the 6 cardinal fields of gaze. I'll have you follow my hand with just your eyes. And I'll now assess the patient's red reflex, which would typically be performed in a dim room. And the patient's red reflex is intact. I'll now have you close your eyes, and I'm going to assess cranial nerve 1, which is olfactory. Can you please tell me what you smell?
Peppermint.
Perfect. And I will then move on to assessing the nares. Nasal mucosa is pink and moist, no septal deviation, no polyps, turbinates are intact. I'll have you occlude each nair one at a time and breathe through your nose. And the nairs are patent. I'll now assess for tenderness of your sinuses by assessing the frontal sinuses and then maxillary. No tenderness is noted. I'll move on to the mouth. You can open up. Oral mucosa is pink and moist. Dentition is intact, no broken or missing teeth. Uvula is midline. Tonsils are at a grade 0. They are not visible. I'm going to assess for cranial nerves 9 and 10. I'll have you say ah. And the palate does rise. I'll now elicit the gag reflex. Great, which is intact. Cranial nerves 9 and 10 are intact. I'll now have you show me your tongue. Can you please move it from side to side? And that's assessing cranial nerve 12, which is intact. I'll now move on to the ears. There is no erythema to the patient's auricle, no drainage, no tenderness on compression of the tragus. I'll now assess the patient's tympanic membrane. Tympanic membrane is pearly gray, translucent, no bulging noted. I'm pulling the pin up and back to assess this. Bony prominences are noted, and the cone of light is present at 4 o'clock. Now I'm going to assess the patient's cranial nerve 8, which is auditory, by checking hearing. I'm going to stand 1 to 2 feet behind the patient and whisper a 2-syllable word and have you repeat it.
Baseball.
Perfect. I'll now perform the Weber test. I'll have you tell me which ear you hear the buzzing sound in.
Both.
Perfect. I'll now perform the Rin test. I'll have you raise your hand when you no longer hear the buzzing behind your ear, and then again in front of your ear. Okay, so air conduction was greater than bone conduction, so the patient has no conductive or sensory neural hearing loss. I'll now assess lymph nodes for any enlargement or tenderness. I'm going to assess the preauricular, postauricular, tonsillar, submandibular, submental, cervical, and supraclavicular. I'll now assess the patient's neck. It is symmetric. The trachea appears to be midline. The carotid pulse is normal, +2, no thrills felt. I'm going to assess the patient's thyroid gland for symmetry. There's no enlargement, no nodules. I'll have you extend your head back and swallow for me. So the thyroid gland appears to be normal. Now I'm going to move on to cranial nerve 11, which is the spinal accessory nerve. I'll have you raise your shoulders against my hands. And if you can press your face towards my hand. Great. So the spinal accessory nerve is intact. I'll now move on to assessing the patient's chest. I'm assessing the skin for any discoloration. I'm noting that the patient is not in any respiratory distress. We have normal rate and depth of respirations. No retractions are noted. I'll palpate for any tenderness or nodules. None are noted. I'll now assess tactile firmitis. I'll have you say 99 when I place my hands on your chest.
99, 99, 99.
And I'll assess posteriorly.
99, 99, 99.
So vibrations are normal. I'll now assess for chest expansion. I'll have you take a breath. Okay, and expansion is equal. I'll percuss over the lung fields, which are resonant. I'll percuss anteriorly. I'll go ahead and also take the lung fields. I'll now assess the patient's heart sounds by listening to the aortic valve and the pulmonic, Erb's point, tricuspid valve, and the mitral valve. S1 and S2 are noted, no murmurs are noted, no additional heart sounds. So now we'll go ahead and move on to assessing the abdomen. I'll have you lie down for me. I'll begin by inspecting the skin of the abdomen. I'm looking for any abdominal scars. There are none. Looking for discoloration or lesions. I'll next auscultate all 4 quadrants of the abdomen. And bowel sounds are normal active times 4. I'll go ahead and palpate lightly in all 4 quadrants and then deeply in all 4 quadrants. I'm now going to assess for any inflammation of the gallbladder by performing the Murphy's test. I'm going to place my hands at the lower margin of the right costal margin in the right upper quadrant. I'm going to have the patient take a deep breath. Is there any tenderness?
No.
So this is a negative Murphy sign, no tenderness, no inflammation of the gallbladder. I'll now assess for inflammation of the appendix by testing for rebound tenderness. I'm going to palpate in the lower right quadrant. Was there any tenderness felt?
No.
This is negative for rebound tenderness, negative for appendicitis. I'll now elicit Robsing sign. I'm going to palpate deeply in the left lower quadrant. Was there any tenderness noted in the right lower quadrant?
No.
This is a negative Robsing sign, negative for appendicitis. I'll now perform the SOAS sign by placing my right hand on the patient's thigh. I'll have you raise your leg against my hand. Was there any tenderness in the right lower quadrant?
No.
This is a negative SOAS sign, negative for appendicitis. I'll now perform the obturator sign. Was there any tenderness felt in your right lower quadrant?
No.
So this was also negative, negative obturator sign, negative for appendicitis. I'll now have you have a seat for me here again, and we will assess the upper extremities of the patient. I'll first look at the patient's skin, noting any discoloration or lesions. I'll assess the digits and nails. Capillary refill is less than 3 seconds in both hands. No clubbing of the digits. Assessing radial pulse is +2. Going to assess for the brachioradialis deep tendon reflex, and it is normal at a +2. Going to have you raise your arms out to the side and then above your head, assessing range of motion. I'll have you squeeze my fingers tightly. Great. So hand grip strength is strong and equal. I will now test for coordination by testing rapid movement. I will have you place your hands on your knees and as fast as you can, move your hands back and forth for me. Great. So the patient does have intact coordination. I'll now have you close your eyes. I'm going to assess for discriminatory sensation. I'm going to place an object in your hand, and you'll tell me what object I've placed.
Okay.
Great. If you will continue to keep your eyes closed, I'm going to draw a number in your palm, and you'll tell me what that number is.
30.
Perfect. I'm now going to assess the lower extremities. I'm assessing for any edema, discoloration of the skin, any hair loss, ulcerations. I'm going to check the patient's deep tendon reflex of the patella here. It is +2 and normal. I'll now assess the patient's popliteal pulse, +2 normal. Dorsalis pedis pulse, +2 normal. Capillary refill, less than 3 seconds of the toes. I'll now have you point your toes and press against my hands. And then I'll have you press against. Great. I'll now have you stand up. You can close your eyes, feet together. We do not note any swaying. The patient is able to maintain good balance. This is a negative Romberg test. With your eyes closed, I'll have you raise your arms out in front of you, palms up. We do not note any drift of the arms. This is a negative pronator drift test. Okay. I'll now have you take a few steps on your toes towards me and backwards on your heels. And then if you can take a few steps heel to toe. Great. And then I'll have you remain standing. I'm going to assess range of motion of the hips. If I can have you extend back. And then I'll have you flex forward at the hips. I'm going to assess the vertebra. No pain, nodules, no sign of scoliosis. Going to have you bend laterally at each hip. And I'll now assess rotation of the hips. Great. This concludes our complete physical head-to-toe assessment.